Welcome to video 9 for chapter 9, Joints in Anatomy and Physiology. So we're going to go over these different diagrams and what they represent. So our first diagram here has rotation around an axis for the arm and the leg. And we could have medial or lateral rotation, but we're just going to label these rotation. Then we can see that the arm is moving away, and then we have an arrow with the arm and the leg both moving away and towards. So if we're going in this direction up here, this is abduction. If we're moving the arm or the leg back down, it's adduction. So we're adding our arm back to our body. This next one talks about flexion. So if we are moving the arm up anterior to the coronal plane, that is a definition of flexion. So both of these are flexion of the hip and the shoulder joint. Extension is moving it back. Here we have the shoulders moving up and down. So we have elevation and we have depression. Sometimes they call elevation deviation, but I like elevation better because it's more self-explanatory. Here again, now we have flexion and extension of our torso. So moving in this direction is flexion. This would be extension. This is more what we think of when we talk about flexion and extension. So flexion would be moving our arm upward to make our biceps look bigger. Extension is moving it back to its normal position at our side. With the wrist, it's a little bit different. This is actually flexion. If we point it down, this is extension. This one is showing that supination, pronation. So this is pronation. This side over here is supination. Here we have the knee. This would be flexion, because the knee is hinged differently than the elbow, and this would be extension. Here, if we move the whole leg around the hip joint, this is circumduction. This one is showing inversion and eversion. So this side is inversion. This is eversion. So if you roll your ankle like this, it's an inversion sprain. This will be an eversion sprain. And then here is doing our toe point and then raising our toes up. So this is dorsiflexion, and this is plantar flexion. So here we go with these diagrams. Now we're going to add one in, and we're just going to draw a little smiley face. And I'm going to draw kind of the jaw here. So if we move the jaw side to side, that is excursion. If we close the jaw, that is elevation. If we lower the jaw, that is depression. Just like with our shoulders, raising it and lowering it. We also can move the shoulders forward and backward, and that's not shown on here, but we'll demonstrate that, and some other rotations that we could have when we Zoom in class.